So good morning, everyone, and welcome to this week's community update. This week, we welcome Tim Beckett, president of Kitchener-Waterloo Oktoberfest. This long weekend caps off another successful celebration where people were able to enjoy the Bavarian festival with virtual or safe in-person activities. Thank you to KW Oktoberfest for adapting this year's celebration to keep our community safe and to everyone who is enjoying the activities safely. As we reopen, it is great to see these much needed reminders of normality in our community, made possible by everyone getting vaccinated and following public health measures. The more we continue to do our part, the more activities like this can safely be delivered for residents to enjoy. Our personal responsibility continues this long weekend. Please stay within the gathering limits of 25 people indoors and 100 people outdoors. Consider having the fewest number of people possible at your gathering. And if you're feeling unwell, please stay at home to keep people safe. There are four enforcement actions to report since the last update, all for failing to comply with face covering bylaw and carrying a fine of $240 each. The Region of Waterloo Security issued 1 ticket at 150 Main in Cambridge, and Grand River Transit issued 3 tickets. I will now pass the floor over to our Medical Officer of Health, Dr. Wong, for an update. Good morning, Dr. Wong.
Good morning, Chairman, and thank you everyone for joining us. So I'll start as usual with my key messages. There are 4 of them. 1, this week, we continue to see the relative stability in our local trends that we have seen for a number of weeks. 2, we know that the activity associated with holiday weekends tends to increase the risk of transmission through close contact. 3, please do not let your guard down this Thanksgiving weekend. COVID-19 is still with us. 4, COVID-19 continues to spread when we are in close contact with each other. Those who are unvaccinated remain the most vulnerable to illness, admission to the ICU, and death. Regarding our overall trends, this week we continue to see the relative stability in our local trends that we have seen for a number of weeks. Since the announcement that Ontario is introducing a vaccine certificate later this month, there has been an uptake in first dose vaccinations. In Waterloo Region, we are entering the fall in a better scenario because of this increase in first doses. Very close to 90% of residents aged 12 and older have had a first dose. Approximately 85% of residents aged 12 and older have had a second dose. Third doses have been given to residents of all long-term care facilities. I would like to sincerely thank everyone who is fully vaccinated and anyone who has recently decided to get a first dose. Please get your second dose too. If you are not vaccinated yet, and you are eligible, I strongly encourage you to reduce your risk of illness, hospitalization, and death from COVID-19. Please get the vaccine for your own protection and to protect those you love. Regarding Thanksgiving health precautions, this Thanksgiving weekend, it is important to continue to practice public health guidelines as COVID-19 still poses a serious risk if allowed to spread, particularly to those who are unvaccinated. Please do not host or attend a gathering this weekend if you are sick or have symptoms of COVID-19, even if they are mild. Get tested if you are sick. It is safest to gather with your own household or a small group of people you know are fully vaccinated. To protect yourself from COVID-19 and participate in activities this weekend, remember the layered approach to protection, what is often referred to as the Swiss cheese model. A layered approach, like layered slices of Swiss cheese, results in fewer holes for the virus to get through. The strongest layer comes from being vaccinated. You can also protect yourself by wearing a face covering, physically distancing, keeping gatherings small, and spending time outdoors or only in well-ventilated indoor spaces. Each of these layers reduces your risk of COVID-19, but they are most effective when you combine them. Regarding rapid antigen screening in schools, earlier this week, the province announced that targeted rapid antigen screening will be made available for select schools and licensed childcare centers if and when recommended by a local medical officer of health. The test would then be made available to those schools or childcare centers by the province. Rapid antigen screening may be useful in higher risk situations, such as where there are higher rates of COVID-19, lower rates of vaccination, and a history of outbreaks in the school or childcare center. We are currently working with the province and other public health units on more specific criteria that can be used to identify which schools and childcare centers may benefit from having this additional screening tool. We are also working with our local school boards and childcare providers to come up with a process to implement rapid antigen screening if and when it's recommended. As announced by the province, participation in rapid antigen screening will be for unvaccinated, asymptomatic children, and it will be voluntary. Rapid antigen screening cannot be used to test Rapid antigen screening cannot be used to test symptomatic children to determine whether they should attend school. I know some parents are wondering if this could replace taking their child to a testing center if they have symptoms, especially if they are mild. It cannot. Anyone who has symptoms needs to get a lab-based PCR test at one of the testing centers. It also cannot be used at this time to test high-risk contacts of a case that have been dismissed due to a case in their class. These high-risk contacts also need to obtain a lab-based PCR test at one of the testing centers. Rapid antigen screening also would not replace any of the other public health measures required for school or childcare settings. It would be an added layer of screening. Anyone who tests positive on a rapid antigen screen should not attend school and should get a lab-based PCR test at one of the testing centers. At this time, we do not have any school or childcare facilities where we have concerns about an elevated risk or ongoing risk of spread. However, we want to be ready so that these tests are available if and when they be recommended. To that end, we will provide more information as soon as we have it regarding program parameters. In closing, I would like to thank the residents of Waterloo Region for stepping up in such large numbers to be vaccinated. I would also like to thank everyone in the community in advance for doing their part and continuing to practice public health precautions this holiday weekend to protect loved ones and our broader community. It is because of you that we are able to do many more activities than we were at this same time last year. Thank you for caring for one another. Please be safe. I'll now pass it back to Chairman, and thank you.
Thank you, Dr. Wong. We'll now hear from David Aoki, the region's Director of Infectious Diseases and Chief Nursing Officer, who will speak about the vaccine rollout. Welcome, David.
Thank you, Chair Redmond. As of 1:30 p.m. yesterday, the regional vaccine dashboard indicated that 89.63% of those residents 12 years of age and older have a first dose of vaccine. With these numbers and our current uptake, we expect that the region will reach 90% of those 12 and older with at least one dose sometime next week. In residents 12 years of age and older, yesterday's update showed that 84.85% are fully vaccinated. We anticipate when today's dashboard updates that it will show that we have passed 85% in those 12 years of age and older who are fully immunized. We continue to work to provide clinics that are accessible and available where people live, work, and play. This week, the bus can be found at the following locations: in Cambridge on Saturday, October 16th from 8:30 a.m. to 12:30 p.m. at the Cambridge Farmers Market, as well as the Cambridge Centre Station on Sunday, October 17th from 12 p.m. to 4 p.m. And in Kitchener at the Central Library in the Centre on the Square parking lot on Saturday, October 9th from 9 a.m. to 1:30 p.m. and Fairway Station near the intersection of Fairway Road South and Wilson Avenue on Friday, October 15th at 3 p.m. to 7 p.m. We continue to encourage anyone who has not received their first dose to walk into any of our clinics or local pharmacies to start their series. As well, anyone who is more than 28 days from receiving their first dose should get their second dose as soon as possible to become fully vaccinated. For those who may still have concerns about getting the vaccine, we recommend speaking to your primary care provider or pharmacist to discuss your concerns. Thank you very much, Chair Edmund. I'll pass it back to you.
Thank you, David. I'm now really pleased to welcome Tim Beckett, President of KW Oktoberfest, to give us an update. Tim, the floor is yours.
Thank you, Madam Chair, and good morning, everybody. You know, 2021, as 2020 did, has brought a substantial change to our festival. You know, and as we continue to build our plans to return to a more normal festival, we've had to pivot, I guess is the word of the day, to something that's a lot different, but working closely with our public health team here on guidance and support around you know, making a safe festival. We're coming up on weekend 3 of the festival. We've shifted so that our festival is now operating you know, a little bit earlier, a little bit lighter, but trying to take advantage of the good weather. And a number of things that we've looked at in order to keep the festival safe is obviously you know, masking and vaccination policies, double vaccinations required for all our events, both indoors and outdoors. You know, we want to make sure things are safe for everybody participating. Our opening ceremonies a couple of weekends ago, a couple of Fridays ago, saw, you know, 100 people or just less than 100 people present, all masked, all socially distanced, and ensuring that everybody that was in that area were double vaxxed. So our limited capacities have seen you know, a change, and we don't have the big fest halls happening, but we've taken advantage of this by helping support local restaurants in the region by operating them as micro fest halls, so they can work within the confines of the rules, but still bring a German Oktoberfest venue or event to people, their patrons that are there. From time to time, Uncle Hans will pop in, or a impromptu cake tapping will happen at one of these micro fest halls. Our big parade that would see 150,000 people gather on Weaver Street this coming Thanksgiving Monday, again, is not happening. But in support of keeping the parade alive, CTV will be providing a parade special again this year, and a look back on previous parades. So we're very excited to see what that brings on Monday. A number of our virtual events have occurred and will be occurring. Obviously, Oktoberfest Live is this Saturday night from Waterloo, live from Waterloo Brewing, but giving people an opportunity to celebrate Oktoberfest in the confines of their own home. We're also, we had the Taste of Oktoberfest. So instead of bringing hundreds of people together for a culinary event, the culinary studio brought that to people's homes, and a great cooking opportunity with your family and friends in your home. Oktoberfest continues to be live on the weekends, giving kids an opportunity. But the one event that we're really happy with is the Wanderwagen. And the Wanderwagen is really about an opportunity to bring Oktoberfest to the communities and polka to the people. And you know, people are asking us, where is the Wanderwagen going to be? Well, we've kept that a secret, and we're not broadcasting a schedule because we don't want people to show up on masses to enjoy that. We want it to be a surprise to the communities, work within the public health guidelines, and ensure the safety for all. This is definitely an event that will come back in 2022, and one that we're going to be happy, hopefully, sharing the schedule at that point in time. Just want to thank everybody for allowing us to keep Oktoberfest alive in the community. Really one that supports local businesses, and also the work that everybody's done to keep us safe. So prost, everybody.
Thank you so much, Tim, and really a shout out to you, the volunteers, and all the Micro Fest Hall, and for keeping the spirit alive. I look forward to going back to a family day next year and many years after with our family. That's always been our Thanksgiving tradition. So thank you for making sure it's going to be there for us. I'll now open up to media. Joanna, do you have a question?
Yes, I do. Just for Dr. Wong, you were talking about the rapid testing for schools and childcare centers. Do you have like more of a concrete timeline on when parents might expect to get more details on that?
We're working as quickly as we can. We want to consult experts at the province, as well as consult with our health unit colleagues who are also having to implement this. As you know, the government came out with this plan to make it available to schools, subject to local medical officer of health recommendation. There weren't really thresholds associated with that, and so we are, working on those specific thresholds and working on operational issues with the school boards, how to actually, deploy the tests once they come into the school boards, et cetera. And so, that will take some time. I can't give you a specific timeline at this point in time, but we are working as quickly as we can, and we will provide more details as soon as we have them.
Joanna, do you have a second question?
Yeah, just a follow-up to that. Just Dr. Wong, your thoughts on having this additional tool for schools?
So this may be a beneficial additional tool. Rapid tests have their advantages, but they also have their limitations. And so we want to make sure that when we recommend them, they can serve as an additional benefit for those schools or childcare settings where we are concerned that there may be a higher risk of spread that would occur at the school, and for which this additional screening may help as another layer of protection.
Justine, do you have a question?
I do. Is there any particular areas or like workplaces that you are concerned about? Is there any areas that people should be more concerned about going to that might be a bit more of a hold off than other places?
You mean in general, like activities that people?
Yeah, like, workplaces and schools have had the most outbreaks. So I'm just wondering where your biggest concern is with the outbreaks and the case.
Oh, I see. Yes. So thanks very much. So, I would say that it comes back to when we see clusters of people, mostly unimmunized, who gather closely together, social gatherings, family gatherings, extended family gatherings, and they don't employ public health precautions or don't do it consistently. That's where we tend to see the most spread. In a school environment, as well as in a workplace environment, for the large majority of situations, what we see is that there are good measures in place. And so when an infected student, comes into a school setting, or an infected worker comes into a workplace setting, the measures that they have in place tend to limit spread. And even when there are outbreaks, for the most part, they tend to be controlled quickly and then called over soon. And so that's what we're seeing now with a combination of, increased immunization rates and those public health measures that still need to be in place for those schools and those workplaces. In social settings, family settings, unfortunately, there's not always good adoption of those measures, especially when there's a lot of unimmunized people, people that are eligible but who haven't been immunized yet, and they're in close proximity. So as an example, Ontario mentioned yesterday, Dr. Kieran Moore mentioned yesterday that Ontario has seen a number of outbreaks associated with weddings. And in particular, when people have gathered socially at, after the wedding, at a reception, for example. And it's often associated with lots of people in close quarters, and not taking, not putting their masks on all the time or taking it off often, and not socially distancing. And then you see this spread that can occur. So that's really we tend to track quite closely, as you know, all the cases that occur in students and educational staff, that in those settings as they occur. We also report on outbreaks in workplace settings, and we monitor other workplace settings that have just one case, for example, that may have showed up infectious. So there's a lot of monitoring and a lot of rules around, those types of settings. So we will be reporting cases related to those settings, but the risk in those settings tends to be low. So for the number of cases of students, for example, the proportion that actually lead to outbreaks is small. Similarly, there's many, many, many more workplaces where we know there's been an employee in the workplace and who could have been infectious at the time they were there, but very few of those actually lead to spread to another coworker, for example. So, I would say that by and large right now, what we have to keep focusing on is those more personalized settings where there aren't those rules, and we have seen spread. So that's the thing I would ask people to think of the most when they are gathering, family and friends in social settings in particular, to just keep up those measures, because that's where we see the spread.
Justine, do you have a second or supplemental question?
I do. This one might be more for David. Is there a large amount of people with a first dose that are eligible to get their second dose that are maybe just haven't done it yet?
I would have to go and look at those numbers. We are closing the gap certainly between those that are first doses and those that are second doses. Like I said, we expect that 85% will be fully immunized, and we'll have 90% will cross next week for those that only have first dose. So the gap between those that had the first dose only and those who are fully immunized is closing. There are people that still might not, but be getting it right at 28 days, and that's okay. There's things happen, but we encourage people to get it as close to when you become eligible for that second dose as possible. We have in the past worked specifically in August and September to contact those individuals who were outstanding specifically before we went to a walk-in model, for those who maybe had appointments but did not attend, and we just followed up with them to make sure they were aware that they could come in and get their second dose as a walk-in, to make sure that, and to make them aware that, hey, your 28 days is now passed. And that was done as well because originally, and the guidance was 112 days. So some people did book second dose appointments at the 112-day mark, and then when the province moved to 28 days, didn't necessarily change those appointments. So we've been working to try and encourage people. Some people are very good, and they're like, I have an appointment in 112 days, I'll just get it then. And we've kind of been nudging to remind. Now we did that in September. We no longer have appointments, but we nudged them and told them all, hey, if you have an appointment and you're waiting, just come now. You don't need to wait for those 112 days. So we continue to try and close the gap, but I don't have any right now. I don't have a number of how many are past the 28 days.
Dr. Wong, did you want to add anything?
No, I think that was well said.
Thank you. Stephanie Villela, do you have a question?
Hi, Stephanie.
Hello. Yes, I do have a question. I don't know if you guys can see me here, but oh, there we go. So I know that there have been several student parties, university parties since the start of school. I guess, so what can be done to kind of prevent these, or is there anything that from the public health stance, what can they do to kind of control these parties?
Well, as you've seen, public health continues to work with our partners, the officials at the post-secondary institutions who have done a great job, and in taking leadership for these issues, as well as our enforcement partners, bylaw, police, etc. So we obviously continue to encourage these post-secondary students and other persons that may be with them to really, practice being safe, because it's not only about them. I understand, and some younger people may feel that they're less at risk, especially if they're double vaccinated, as is required often for their post-secondary education. But what we see with Delta is that it is very formidable in that it is very, very good at seeking out any vulnerabilities. So, somebody who is young may get infected, may not have many symptoms, but, they could potentially pass it on to those in their family or loved, circle that they care about, who are more fragile, and these people can become quite sick, and we've seen that. So it's about also protecting those around us, especially those who are more fragile or who can't yet be vaccinated. So I would encourage all those, all of us to think about that when we partake in activities.
Stephanie, do you have a second question or supplemental?
Yep, I have a second question. So I was looking at the Waterloo Region dashboard, and the vaccination rates for the 70 plus and the 80 plus age group, those who are fully vaccinated, are below 90%. But when we compare that or look at the provincial average or other regions, the fully vaccinated rate for that age group is above 90%. So what is public health doing to kind of push that age group forward and get more of that age group vaccinated?
David?
Yeah, so we are continuously working. We work with our long-term care homes and retirement homes, and they have good rates. What we are also doing is working with areas that are called naturally occurring,
Retirement communities.
Retirement community. Thank you. I had it. Thank you, Shuli. Naturally occurring retirement communities. So those are communities where generally people who are retired may congregate, but are not an official congregate setting. And we are working, and this is some of the things we're doing with our mobile nursing teams and the bus to try to do outreach with those communities to encourage vaccination among seniors who may not be in congregate settings. And we continue to do that on a regular basis, working with our community services who may know of some of these housing areas that are called NORCs, naturally occurring retirement communities, and as well as continuing to work with other congregate settings that may that may have not be official retirement homes and long-term cares, but have seniors to work to get their first or second doses to complete. So we are working on a regular basis with partners and communities to try to encourage vaccination in that population.
And trying to bring the vaccination to them, as David had mentioned earlier, with the buses and things like that.
Thank you. Casey, do you have a question?
I think everything I had has pretty much been covered, so I'm okay.
Okay, thanks, Casey. Kate, do you have a question?
I am also going to pass today, but thank you very much and happy Thanksgiving, everyone.
That's great. Well, shout out to all the media that have already asked everybody's questions. Are there any additional questions from any of the media? Joanna.
Thank you. I have a question for a colleague who's interested in learning more about the increasing cases in rural North Wellesley, and wondering if that's among the Mennonite community. And just wondering, is that something you guys are tracking? Is that related to vaccination rates, or what's going on there?
Yeah, definitely. I mean, we take a look at where we see increased rates within Waterloo region, because that can be in sub areas of the region, as well as vaccination rates. And we have been working with a variety of healthcare partners, who service populations in the rural and north part of Waterloo region. And regardless of their faith, there could be people of all different faiths who haven't been immunized yet, and whom we'd like to continue to encourage to be immunized. So there continues to be efforts made in that area as well, and we work with primary care leaders. We work with the local municipalities. We work with the healthcare providers that are in, and the clinics that are in those areas. And I don't know, David, if there's anything more that you might be able to add. I just know we have regular conversations and take their ideas about how we may be able to make the vaccine more accessible to them. And that's why some of the bus locations have been in that area in the few recent weeks.
Yeah, I don't think I have anything more to add to what you say. That's our strategy, similar to the naturally occurring retirement communities and all areas that we deem in the region that are, that we need to try and get our vaccine rates increased. Is we're working with, community leaders, healthcare leaders, primary care, the communities themselves, to engage what the best way to provide vaccination. And again, similar to what Shuli said, we know that vaccination is just one piece but it is the strongest layer of protection. So we are working continuously with all communities to try, and certainly our townships are one that we're working with regularly as well.
Thank you. Any more media questions? Joanna.
Just a follow-up. When you mention efforts are being made there, you mean specifically related to vaccination? And would a lower rate of vaccination, would that be related to people not being interested in it, or it's just more difficult to get it?
There's definitely areas in our region where there are lower vaccination rates and where we see less interest in the vaccine. Yes. We're trying to listen to the community and the providers that serve them for any additional ideas they may have on what additional information they may need to help them feel more comfortable in getting a vaccine, and if there are any additional ways in which we could make access to the vaccine easier for them, if access is an issue. I would say right now it's more that there isn't as much interest in the vaccine as opposed to access issues. But it's not always easy to tease out the two, and so we're just continuing to work with the community in order to try to remove any barriers that may remain.
So I see no more questions. I want to thank all of you for coming today, and specifically Tim Beckett, President of KW Oktoberfest. Thank you very much for giving us an update. We look forward to enjoying either sharing or enjoying our German heritage. I think we all sort of pretend we're German for the length of Oktoberfest to enjoy the festivities. So thank you all very much for coming. Wish everyone a safe and happy Thanksgiving, and have a great weekend.